Hello and welcome to the Healthy Minds Speaker Series. I'm Peter Neufeld. I'm part of the HR team here at Maple Leaf. Today we're going to be trying something different. So for those of you who have attended before, you know our regular format is that we have a great speaker come in. We hear from them on a different topic for about 15 minutes and then we have a Q&A. Well, what happened with our guest today, Leslie Beck, is she gave such a great presentation that we completely ran out of time to handle all the questions. So we've decided to mix up the format today. And so today's topic is going to really be an entire time of Q&A. And so the conversation that we had the last time when Leslie was here is she was speaking about the benefits of an anti-inflammatory diet and how it can help positively in terms of preventing or lessening symptoms of anxiety and depression and its benefits for overall mental wellness. So clearly that topic resonated with people in a very significant way. And so we're going to build on from that. So again, Leslie, welcome, and thank you so much for being willing to join us again today.
Well, it's great to be back. Thank you for having me.
Yeah, no, it's amazing. So folks, what I'd say is if you have questions, please click on the link at the top. There's a man or a person raising their hand. You can just click on that person and then you can ask your question. To kind of warm us up though, I'm going to look at some of the questions that we've had from the last time. So I'll grab a few of those as you're kind of populating your own questions and then we'll go from there. So one of the questions that we heard last time was around a pescatarian diet. And the question was, can a pescatarian diet be modified to a Mediterranean? And I'm wondering, Leslie, before you answer that specifically, even just at a high level, because we've talked about anti-inflammatory, and here I'm using the language of Mediterranean. So if somebody hasn't joined the last session, can you make that connection? And then we'll jump to the complexities of this one.
Yeah, no, for sure. So what I talked about when I presented, I guess a couple of months ago, was how an anti-inflammatory diet, so one that's got a lot of plant foods in it, daily fruits and vegetables, whole grains, nuts, beans, and lentils, just not a lot of red meat, olive oil, extra virgin olive oil is the primary fat, how a diet like that can help prevent developing depression, and randomized controlled trials have shown it can also help treat it. And those studies that have found this kind of diet can help treat it used a Mediterranean style diet. So a Mediterranean style diet, it really is a very good example of an anti-inflammatory diet, one that's got lots of plant foods in it on a daily basis, not a lot of sugar, not a lot of red meat, uses olive oil and so forth. So that's the background. So what about a pescatarian diet? So a pescatarian diet is basically, it's a vegetarian, people who follow a vegetarian diet, but also sometimes occasionally eat fish and seafood. Some pescatarians also continue to include dairy and eggs, but not all pescatarians. So I would tell you right off the bat that a pescatarian diet is a good example of an anti-inflammatory diet. While a Mediterranean style diet, it still is an anti-inflammatory diet. And in fact, studies have found that when you look at some of these healthy dietary patterns, they found that a Mediterranean style diet, a DASH diet, and vegetarian diets, including pescatarian diets, are associated with a lower risk of cardiovascular disease, a lower risk of heart disease, and a lower risk of stroke. So already, it's a good source. So in terms of, how do you make it more like a Mediterranean style diet or Mediterranean diet, I suppose, will continue to include fish. I would probably include fish in your diet twice a week, oily fish, high in omega-3s. Make sure, as you probably already are as a pescatarian, getting beans and lentils and whole grains in your diet. Look at what your principal cooking oil is at home, and I would make it doesn't have to be the only one, but the main fat, your go-to fat, should be extra virgin olive oil. And I don't think it doesn't matter that you're eating just a little bit of red meat or you're not getting chicken. That's not necessarily the healthfulness of the Mediterranean diet. It's really more of a proxy. People, chicken in the diet, etc., that you're eating less red meat. So I think bottom line, pescatarian diet is an example of another anti-inflammatory diet with health benefits.
Excellent. So I have a question on, because you talked about oily fish, and the go-to oily fish in my family is always salmon.
Mhm.
But I've noticed recently we're getting tired of it, and so we've
Okay.
been eating more trout. Would
Yeah.
trout still qualify, or is that, not in the oily fish family?
No, it absolutely would qualify. So salmon really is up there for the amount of omega-3 fats per serving. Trout is also a good source, a little bit lower. If people like to eat sardines, those herring, those kinds of fish as well. And the other source, this is something I just, well, tuna is also a source of omega-3s, but albacore tuna as opposed to the light tuna. Like when you buy canned light tuna, it's smaller species of fish. And it doesn't have as much omega-3 in it. So I've really always steered people away, if they eat tuna on a regular basis, not to buy the canned albacore tuna, because it is higher in mercury compared to the light tuna. Smaller species of fish, again, they don't live as long, and so they don't have as much time to accumulate mercury from the water, their environment. However, I just learned recently that albacore tuna that's fished in the Pacific Northwest, so product of Canada, that albacore tuna, not only is it a good source of omega-3s, it's low in mercury. So you might want to, if you like tuna and you're usually buying it and you want to have a low mercury fish, which I recommend, is when you're buying canned albacore tuna, you need to look on the label for product of Canada.
Okay, great. A nice Canadian plug too. Another question here is about water intake. It says, how many liters should we drink a day? And is there a certain time when you should drink the water, or is it just all day?
Yeah, that's a good question. Okay, so so in general, healthy men need 3 liters of water per day. So that's, 12, 13 cups. Women need 9 liters a day. Sorry, 2.2 liters a day, about 9 cups of water. Of course, if you're working out, if you're exercising, you will need more. If it's really hot out, you're going to need more as well. So you might be thinking now, oh, I don't even come close to that. But here's the thing. So all beverages, with the exception of alcoholic beverages, count towards your daily water intake. So you can count tea, you can count coffee, you can count that latte with milk you drink. A lot of people think that caffeine is a diuretic. If you habitually drink caffeinated coffee, then caffeine does not cause your body to lose water. So that's one thing. In terms of when you should drink it, it really basically throughout the day. And that's, if you drink, let's say, 2 or 3 liters of water first thing in the morning and you think you're set for the day, within a couple of hours, your body is going to excrete what it doesn't need. So you really do need to be drinking it throughout the day to stay hydrated.
Have you found any tips to help people to actually do that? I know my wife has an app that says, like, remember to water your plant. But I don't know, is there anything that you found to be effective to help people to actually follow those practices?
Yeah, there's a lot of different apps out there to remind you to drink water, but I think probably the best thing to do, if you're not in the habit of it, you don't think about it, is you've got to keep it in sight. You have to keep water in plain sight. So if you're at your desk, you should have a pitcher or a bottle and a glass, and be just as a reminder to be drinking throughout the day. And maybe set some goals. If you're working all day, have or you should be drinking, you have to have, perhaps, I don't know, a liter of water by 11 a.m. or 12 p.m. But yeah, it has to be in sight so that you remember to drink it.
Yeah, no, it's great. So I have some questions here. Thank you for the questions that have come up. And we are having a little bit of, I think, a Wi-Fi issue, but so folks, I think we're all used to that. So we'll just adapt. A question on thoughts about farmed versus wild caught fish. Farmed versus wild fish.
Right. Well, it depends what you're talking about. So I think years ago, 2004, there was a study that got a big media attention that it compared farmed and wild caught salmon, and it looked at certain toxins, and it concluded that wild caught is better. It has less of these chemicals, PCBs, etc. And basically, it was clinically insignificant, but it made a lot of attention. So what I would say to you now, regardless, you can't buy, well, you can buy frozen wild fish now, but it's not the season for it. So I would basically say that today aquaculture practices in Canada, they do a really good job of feeding the fish properly, taking care of the environment. So I wouldn't be afraid to eat farm fish, but what you should do is look for fish that comes from an eco-certified farm, or if you're buying it wild caught, a eco-certified fishery, which means they have practices that don't harm the environment. And that would be my best advice.
Sticking with the benefits of omega-3, if you don't eat seafood but take omega-3 supplements, is that sufficient?
Well, yes, you're still getting your omega-3s, whether, let's say, you don't like fish, so you take a fish oil supplement that has DHA and EPA in it, the two omega-3s fat, you are still getting that. If you are a vegan and you won't eat fish, then you can take a DHA, the omega-3 fat that comes from algae, as opposed to the fish oil. And that's where fish get their omega-3s. They eat algae and small plants, sea plants. So you can certainly do that. So yes, you're absolutely getting those omega-3s. DHA is important for brain health. It gets to our brain. It's the only omega-3 that gets to our brain. Very important component of our brain cell membranes, keeps them healthy. I guess the only difference would be, fish comes packed with a lot of other nutrients as well. Obviously, it's a great source of protein. It's a very good source of selenium, which is an antioxidant needed for our immune system as well. And salmon is an excellent source, one of the very few sources besides tuna that's a good source of vitamin D. So, I mean, it's the same thing. When you don't eat whole foods and you distill it into a supplement, it's different, but at least you're still getting your omega-3s.
There's a lot of questions here about the diet. As an alternative for extra virgin olive oil that's Mediterranean friendly, since the oil smoke point is quite low, what's best for cooking?
So actually, the smoke point, which is the temperature at which an oil starts to burn and break down, the smoke point for extra virgin olive oil is actually 410 degrees Fahrenheit. So you can saute, you can bake with it at 400 degrees or less. You can saute on the stove. What you can't do with extra virgin olive oil would be really high heat stir fry, but you certainly can cook with it. So I would use those. I guess the other oil that it's not part of the Mediterranean pattern, but it certainly is an oil that also has a high percentage of monounsaturated fat, like olive oil, not quite as high, but it belongs to a traditional dietary pattern called the Nordic diet that you may have heard about. And it's getting more attention. It's a traditional dietary pattern shown, not as much research yet because it's newer, but it is shown to help reduce the risk of heart disease as well. And the principal oil in that is canola oil. And that's what we grow here in Canada as well.
So there's a question here. It's one that I've had myself. Actually, when I was shopping yesterday in the grocery store, I was thinking, should I pay this extra amount for the expensive extra virgin olive oil versus the regular? Are there any health benefits beyond taste?
Well, that's a really tough one to answer because it's taste, it's purity, etc. But in terms of, so extra virgin olive oil, the oil is extracted from olives using minimal, no chemicals and minimal heat. So you retain lots of those phytochemicals that are in the olive, and you don't kill off the vitamin E by high heat extraction. So presumably, if they're both being extracted that way, they should still have, phytochemicals in them, vitamin E, etc. But we don't know that because they don't analyze it, and we can't see that on labels.
There's a question here too in terms of looking, and I guess it's a higher level question in terms of the benefits of organic versus non-organic as an overall approach to eating. Now that might be quite a loaded question, but
Yeah, it
people
is.
are quite interested, you know, in your thoughts on that.
Okay. So let's talk nutrition first. From a nutritional standpoint, yeah, studies have found that organically grown crops, fruits and vegetables, some of them do have higher amounts of certain antioxidants, certain nutrients compared to conventionally grown. But really, how meaningful is that? Is the difference isn't a lot. The difference isn't going to make a difference to your overall nutrient intake or your health. I think really when you think about, it's a personal decision to go organic, and it really comes down to it, and often it's an environmental reason why people choose organically grown crops are supposedly better for the environment. Now, mind you, we're not talking about buying an organic tub of spinach that's shipped up here from California. I mean, that's a different argument altogether. But I think it's a very personal decision. I think on a nutritional standpoint, there really isn't a lot of difference. There's more environmental difference. And I think from animal foods, you know, some people may want to choose organic animal foods because, you know, they don't have any antibiotics are not used to prophylactically for the animals to grow, and also in Canada, hormones aren't given to beef cattle to be organic. So there are some reasons why some people may choose to go organic.
There's a number of questions here where people have been asking questions about avocado. And they're saying, is that a good supplement in terms of adding monounsaturated fats to your diet?
Yeah, absolutely. It's right up there. Avocado oil, very, very high in monounsaturated fat, like extra virgin olive oil, lots of fiber, really good source of a B vitamin called folate, which helps keep the DNA of our cells healthy. So a very, very nutritious fruit, which we don't often think of it as a fruit. It's actually, I treat it as an added fat to the diet. And in fact, 1/8 of a regular size avocado, so not the tiny little ones you buy in the netted bags, but 1/8 of an avocado is the equivalent of a teaspoon of oil.
So there's a question here on about caffeine. So I'm going to ask you a few questions on drinking. We'll start with caffeine and then we'll move to wine. So,
okay.
So starting at the day here, so it says, does my caffeine intolerance impact change because of the level of caffeine? So the type of caffeine I'm having, or is it just the number of cups I have a day? So is the type of coffee impacting the amount of caffeine, or is it just focus on the number you have?
I would definitely focus on the number of cups of coffee you have and consider the total amount of caffeine you're consuming. Yeah, there are differences, and I don't know exactly in terms of different types of coffee beans they'll differ a little bit in their amounts of caffeine. And then roasting, whether it's dark roasted or the extent to which it's roasted, will affect caffeine content as well. But I think the number one thing to consider is how much caffeinated coffee you're drinking per day. And generally we say an 8-ounce cup of caffeinated coffee, and I don't know, most people, 8 ounces today is pretty small in this world of big food and big drinks, but 8 ounces can have, I've seen anywhere from 110 milligrams of caffeine. That's pretty on the low side, up to 175 milligrams. And in terms of general recommendation for caffeine, we tell women, you know, ideally consume no more than 300 milligrams. Other people, women of childbearing age who could get pregnant, and other adults, 400 milligrams per day.
So I said we have a few on drinking. So we've got coffee, now we'll go to water. And so we'll go back to earlier, the conversation. But the question is for water intake, if you drink the recommended amount, but you have to go to the bathroom several times, is that a sign that you're drinking too much?
It could be too much in one sitting, definitely. But if you have to urinate frequently, I mean, you should be urinating during the day. You should have to go to the bathroom. Otherwise, it's a sign that you're dehydrated. So I wouldn't say that it may be a sign that you're drinking too much. And I think the key is just to think about, reflect on how you're spacing out your fluid intake during the day. And if you're, you go through the day, you're so busy with work, and then you really don't think about it because you it's out of sight, out of mind. And then you come home, and you're not come home, we're all at home right now. But you finish your work day, and then you start drinking your fluid into the evening, and you have to wake up in the middle of the night to go to the washroom. Yeah, you're drinking too much at the end of the day. So you need to space it out.
So now a question about red wine. What are your thoughts about red wine consumption? And do you have any thoughts, this is a term I don't know, about XD red wine? And I think it has something to do where the sugar content is lower compared to other wines. It's a pretty specific question. Do you have familiarity with it?
They mean extra dry? I don't know what that, I don't know exactly, could be. So red wine, so I talked about, no, I didn't talk about this last time because we were talking about a different aspect of mental health. So there is a dietary pattern out there called the MIND diet. And it has been shown in two very large observational studies, this pattern of eating to slow the rate of cognitive decline in healthy older adults living in the community. This research was all done in Chicago, and also reduce the risk of Alzheimer's disease over the 5-year study. There is now going on with this diet a randomized control trial to actually prove that that is the case. So anyway, the MIND diet has 10 different brain-friendly food groups. Believe it or not, one of them is red wine, and you get full points on this diet if you have 1 5-ounce glass of red wine per day. If you have 0, because you abstain from alcohol, not that that's a bad thing, you don't get any points when we calculate your MIND diet score. If you have more than 1, you get 0 points as well. So the best intake is 1 5-ounce glass a day. And it's thought that the antioxidants in red wine, that pattern of drinking is associated with low levels of inflammation in the brain, whereas drinking more is more harmful. So red wine, yes, it seems to be good for you. And doesn't mean that you should start drinking it if you don't. And there are certain a red wine, how it's different than white wine is because it's made from the whole grape, the skin and the seeds. It does contain more polyphenols, which are potent antioxidants and anti-inflammatory compounds. Whereas white wine is just made from the flesh of the grape, so you don't get all those phytochemicals. I've read, I forget which area, but Cabernet Sauvignon is supposed to be the highest in the antioxidants, particularly from, now I can't remember if it's a region in France, but in France and Italy, they seem to have higher levels of these antioxidants. As for sugar, unless you're drinking a sweet wine, like a sweet white wine, all dry wine is very, very low in sugar. It is really low in sugar. And in fact, where you get your calories from when you drink has got nothing, when you drink wine, doesn't have to do with sugar. It has to do with the alcohol itself in the wine that's giving you the calories.
So I have a question here, and it's about kind of the size of your meals. So regardless of the type of diet I choose to have, does the old adage 3 square meals a day still apply? Or is it better to eat more smaller meals?
It depends, I think, on who you are, what your metabolic health is, if you have diabetes, low blood sugar, what your schedule is during the day. So I don't think there's a one size fits all at all. So I think some people absolutely, they can go through the day 3 square meals. you know, and you know, if you go longer, well, and they may not need a snack to give them some energy or ward off hunger at the end of the day. Other people, they prefer grazing, you know, and having, that's hard to do though. You know, have 6 small little mini meals rather than 3 sort of normal size meals. I think that's for many people, that's impractical. And I also think that if you're always feeding your body, even if it's, you know, super healthy foods, if you're constantly taxing, not taxing isn't quite the right word, but your body's always having to deal with that blood sugar or those incoming fats and metabolize them. And yeah, sometimes it's good to give your body a break. And of course, that's the whole principle around the whole notion of time-restricted eating. A very popular form of intermittent fasting is eat your 3 meals within an 8-hour window, maybe, and then let your body fast for 16 hours. So I guess bottom line, there isn't really a right answer to that.
Yeah, no. So as we're coming into longer days now, and so you know, our days are darker. Before this call started, you and I talked about it briefly. I think we're all kind of gearing up to make it through winter. And I wonder, do you have any thoughts from a nutritional standpoint in terms of how we can kind of prepare our bodies for the winter?
Oh, so where do I, well, I think, you know, in the winter, we always, you know, normally think about, you know, staying healthy. We focus on our immune health, and that's especially so this year. So perhaps that's how I could answer this question, is that really think about, you know, fueling your body with those foods that really support your immune system. And so, I mean, many nutrients are important for the body's immune response, but I think a few of them to talk about, I mean, vitamin D, I will talk about right up front. And I would say that everybody should be taking a vitamin D, every healthy person should be taking a vitamin D supplement today. And that's because in Canada and parts of the northern US, we're making little to no vitamin D in our skin because of the lack of sunlight. We all think about vitamin D as a nutrient for bone health, but its benefits go beyond bone health. Many different tissues in our body have receptors to vitamin D. Our heart, our muscle, our brain, our immune cells, meaning they all need vitamin D to function properly. And there certainly have been some studies showing that being vitamin D deficient does increase the risk in older adults of upper respiratory tract infection. You know, it's in its early times, but there is now some research connecting vitamin D deficiency to COVID-19 susceptibility, severity, not proof, just association. So I generally recommend, you know, 1,000 to 2,000 international units of vitamin D3 per day, especially in the winter. Some people may need more to maintain a sufficient level. The other one I would think about is zinc. Zinc is a mineral that also plays an important part of our immune system. It helps to develop immune cells. It helps to produce antibodies, good foods. And studies also show in older adults that those who have inadequate levels in their body have a greater risk of developing pneumonia and a longer duration of those symptoms compared to people who have adequate zinc. So good food sources would be, well, oysters are the best, but we don't eat those every day. So beef, chicken, pork, pumpkin seeds are an amazing source of zinc. So are cashews and chickpeas, yogurt and milk. And you can always get a little bit of zinc in a daily broad-based multivitamin and mineral supplement. And I think that's a prudent thing to do, you know, just as a way of bridging any potential nutrient gaps in your diet, particularly so for older adults. And then I guess the other one we talk about is vitamin C. We know that that's important for immune health. And I do encourage people to include 2 vitamin C rich foods in their diet every day. Of course, we know citrus food is a great one, but you know, strawberries, mango, pineapple, those are easy additions to smoothies and protein shakes. Green and red bell peppers are really high in vitamin C, tomato juices. And yes, you can take a supplement to top up your diet. You don't need to take more than 500 milligrams a day, once a day. And that you can take it twice a day if you like. And that's because at doses 1,000 milligrams and above, the amount you absorb in your intestine falls to less than 50%.
So as a summary there, just to test my memories, so it was vitamin D, zinc, and vitamin C are the core ones to focus on?
I would say yes. Well, there are, yes, those are 3 important ones. Vitamin E is also important, and that's in nuts and seeds and vegetable oils like grapeseed, sunflower, safflower. And you'll get a little bit of that in a multivitamin along with your zinc, selenium. But yeah, those are the ones I'm talking about. I mean, zinc is talked about a lot, vitamin C is, and vitamin D. So multivitamin, you can take a 500 milligram vitamin C, but include it in your diet as well. And then, of course, your vitamin D.
So folks, we've already come to the end of our time. Thank you for all your questions. We still didn't get to them all. So there's obviously a lot of interest in this topic. If you haven't had a chance to watch what I would call part 1, I'd encourage you to go to my LMF and you can view the download of that session where Leslie talks about the entire Mediterranean diet, and you can get more information there. Leslie, thank you so much for joining us again, a wealth of information. And so greatly appreciate it.
You're welcome. Thanks for having me.
And folks, wish you a great day and thank you for joining us. Take care.